Orthopedics and knee. Here's some knee problems for you. There's supposed to be experts in the hip and the knee. How would you deal with these? Case 1, a squat patella, 38-year-old, anterior knee pain. Clonks but tract swell, looks up and out. What to do? Case 2, old oscillatus latus. Look at the swelling around the tibial tubercle. 61-year-old, it's asymptomatic. Case 3, swollen fat pads around the patella tendon, Hoffer's syndrome. Here's another case, tibial spinal avulsion, 18-year-old, unstable. A complex meniscal tear. Here's a lateral plateau fracture in a 60-year-old. Here I am, I put it back in position, I use a synthetic bone graft called Vitos, V-I-T-O-S-S. So small incision, elevate, reduce the fracture, put the Vitos underneath it, it's like putty, and then fixed it with a plate. Here's another case of a uni knee replacement where the tibial component has subsided. Here's an interesting case of a patellofemoral articulation. Used to be done a lot in the 60s and 70s in Europe. Seems to have come back. It's certainly a big need for it in patients 55 plus with severe anterior knee pain. Here's a maltracking patella. What I do with these, just use a knife, a scalpel, via small incisions. Be careful introducing sharp blade and just release the tight lateral retinacular structures. OCD, typical area medial femoral condyle, 41-year-old, causing locking. Here's a loose body in a suprapatellar pouch. Here I am removing it. Here's a patella tendon avulsion from the lower pole of the patella, and a 15-year-old. I managed non-operatively. A lateral meniscal cyst, large bulge here near the lateral joint line or just below, associated with the ultrasound confirmed tear of the meniscus. Here's a torn biceps femoris in a 60-year-old man. MRI shows a tear. So it's a posterolateral corner of the knee. How would you manage this? I'm going to manage non-operatively in a hinged knee brace, and do the MRI said the PCL is okay. Hope you enjoyed these cases.